Right, let's turn to this now. The South African medical sector is engaging clinicians from India's largest private healthcare company, Apollo Hospitals, on their advanced proton beam cancer therapy and cancer treatment technology. The life-saving treatment could be a major step forward for the country should it become available. Proton therapy has multiple advantages that target tumours and cancer cells with precision and minimal exit dose, thus reducing the overall toxicity. Newzroom Afrika's Nobuhle is joining us live now from Durban, where the medical symposium is underway. Good to have you, Nobuhle. What are we learning from this symposium?
So at the beginning of the symposium, when a board member of the South African Medical Association started off, kicked off the proceedings where we had a number of presentations, including one from a head doctor from that Apollo Center in India, she did mention that, there's a few similarities rather to draw between South Africa and India in terms of, our income state and the state of the country, and just saying that what she's seen so far in terms of cancer treatment with some patients is that they essentially, at the end of it, because of the harsh treatments that they receive in terms of radiation, for example, some of them even, abandon treatment because, of the side effects and because of how it leaves them feeling. So this new treatment that we learned about today is essentially a game changer and could be, life changing for those patients. That I just made an example of in terms of them receiving treatment. Let me bring in Dr. Srinivas Chilukuri, who is the senior consultant at the Apollo Proton Center, and he's in oncology, radiation oncology. And let's just speak to him about, number one, this treatment. What kind of treatment is this, and how is it going to change the state, of treatment in South Africa particularly?
So cancer patients receive different kinds of treatment once the diagnosis is done, such as surgery, chemotherapy, and radiation therapy. And radiation therapy is either done through X-rays, which is the most common form of radiation therapy, and we have now proton beam therapy, which is essentially much more advanced and sophisticated form of radiation therapy. Essentially the difference is proton therapy can stop within the tumor. Unlike X-rays, there is a lot of spillage of normal radiation doses to the healthy normal structures which cause the side effects. Proton therapy can stop within the tumor. We can make them stop, and therefore the side effects related to radiation spillage across the normal healthy tissues is minimized.
All right, so let's speak to us about what kind of cancers this therapy treats.
So 90% of patients whom we treat at our center belong to these 4 or 5 categories. One is the brain tumors. One is the pediatric cancers, whenever a child requires radiation therapy for the cure of cancers. Skull base and paraspinal tumors, where there are challenging tumors to operate, to give radiation. So those are, again, the important indication for proton therapy. And of course, those patients who require second-time radiation, these are again the most common form. And of course, there are other forms of treatment, other forms of cancers which can be used with treatment with proton therapy, such as more common ones, the breast, the prostate. But very, very, very selected of these patients could benefit with proton beam therapy.
Dr. Chilukuri, you did speak, and you just made mention now that in some patients, radiation does cause second cancers. So proton beam therapy, speak to us about how that plays a role.
So radiation therapy does cause multiple side effects. Patients could have growth stunting. Patients could have intelligence and memory dysfunction. Patients could have thyroid problems. Patients could have second cancers. Patients could have cardiovascular problems. Kidney problems. Patients could have infertility and sexual insufficiency, etc., etc. So these are all could be caused by both surgery, chemotherapy, and radiation. Radiation therapy is also a common culprit of all these side effects. And proton therapy, because it doesn't deliver much doses to normal healthy structures, we could spare all the healthy organs which could be leading to these side effects, and therefore minimizing or mitigating these side effects. So proton therapy can potentially lead to reduction in the second cancers. Patients could have normal cardiovascular function. Patients could have normal gonadal function. So essentially, we can maintain the function without hampering their long-term quality of life. So, as you know, the survival of cancer is getting better and better. But what is problematic is survivorship. That means the quality of survival, and that is going to be better with technologies and techniques such as proton beam therapy.
All right, and then just lastly, I know that I asked you to be please brief, but speak to us in ordinary layman terms what proton beam therapy is for those who maybe don't have an understanding.
So essentially, proton beam therapy is a type of radiation therapy, but much more safer, much more precise form of treatment, wherein the tumors receive the full doses of radiation and the normal healthy tissues receive almost no doses of radiation. So because the normal healthy structures do not receive any doses, the toxicity is less. And because the tumor can receive full doses without giving any doses to healthy structures, the radiation oncologist can increase the dose to the tumors, thereby creating an opportunity to improve tumor control. So you have two benefits: improving tumor control and reducing the side effects with proton beam therapy.
Thank you very much. That is Dr. Chilukuri, who is from the Apollo Treatment Center in India. Quickly, allow me quickly just to also bring in Dr. Enika, who is the head of neurosurgery at UKZN, and he did a presentation at the symposium just speaking about the different kinds of tumors that they have to deal with. And I just want to bring him in to ask him how he thinks this kind of treatment would assist South Africa.
Hi, thank you. I think this is quite an important treatment option for South Africans. As we know, cancer has an increasing prevalence in South Africa and is one of the most important diseases that we have to attack as a nation. And I think, as eloquently explained as well, this type of treatment offers an option for most patients. And as a neurosurgeon, I deal with a lot of delicate tissue in the brain, the nervous system. And as explained, this type of therapy offers that protection as well to the vital structure, so to avoid toxicity, so that patients can recover and carry on with their lives and become productive members of society. So it is quite an important treatment option for patients with brain cancers and other cancers, of course.
Thank you so much. That is Dr. Enika, who is the head of neurosurgery at UKZN. And, just a brief outline of this is that this kind of treatment, has a toxicity profile that is better and side effects profile that is also better. Back to you in the studio.
All right, Nobuhle live for us in KwaZulu-Natal. Thank you very much tonight.